So, good morning, everyone. My next topic will be covering regarding myopia and its impact on the community. So, myopia, an impending pandemic. Are we truly ready to combat it? So, we have a myopia clinic at our own center in Varangal, Sharath Maxi Vision, and we are actively involved in controlling myopic progression since the past 2 years. So, how are the global trends of myopia? The current prevalence of myopia is around 23%, of which 3% are already highly myopic. And even now, parts of East Asia and Southeast Asia, like Singapore, Taiwan, Hong Kong, South Korea, 80 to 90% of young adults are suffering with myopia. And current global burden, around 23% are affected with myopia, among which 3% are highly myopic. And the postulated global trends state that by 2050, around 50% of the world population will be myopic, among which 10% will be highly myopic, which means that for every two individuals, one will be myopic, and for every 10 candidates, one will be highly myopic. So that configures to around 1 billion world population to be highly myopic. And problem with high myopia is that around 70% of candidates with high myopia land up with retinal disease, which causes irreversible visual impairment. And this brings about the global burden of myopia to about $1.2 trillion. Why is it so important to control myopia? By controlling one diopter of myopia, we can reduce the risk of myopic maculopathy by 40%, the risk of open angle glaucoma by 20%, and the risk of visual impairment by 20%. So, are we truly ready to combat myopia? A recent survey stated that in the Indian perspective, only 1 to 3% of the population are taking up myopic control therapies, and 90% they are either undercorrected or corrected by using only single vision lenses. So, we have a dedicated myopia care unit at our center in Varangal. We are active since October 22 and we are officially launched from March 2023. Our mission is to identify, educate, and treat children at risk of high myopia. And we are equipped with total facilities for screening, diagnosing, and controlling myopic progression. So, these are the myopic risk factors where the younger the child is, the risk to turn out to be highly myopic. And if the parents are myopic, either one or two of them, the child's risk to turn out myopic will be more. The less the time spent outdoors and the more time spent with gadgets increases his risk on myopia. And we established a screening protocol to screen at risk myopic children. So this is the screening protocol where children less than 16 years of age, if there is any myopic progression of more than 0.5 diopters in the past 1 year, and if the child is a first timer with previously undetected myopic refractive error, if the child is already highly myopic, and children with mild to moderate myopia with risk factors, they are at high risk for myopic progression and the tendency to turn out to be highly myopic. So we established a uniform protocol for myopia care, that is to identify the child. If the child belongs to the target group, we need to rule out whether the child has any associated risk factors. If there are any associated risk factors, to see if there is any progression of more than 0.5 after in the past 1 year. If so, establish it with cyclorefraction. If it is truly a myopic progression which is more than 0.5 diopters, then confirm whether the child is truly an axial myope or not by doing a biometry study. And after doing a biometry study, try to compare the myopia growth charts with the normative data and see whether the axial elongation is normal or abnormal. If it is abnormal, then try to adapt myopia control strategies which suit the child. So, how should be our focus forward? Our focus forward should be to prevent onset of myopia, and if a child is truly myopic, to prevent progression of the child to high myopia, and if the child already has high myopia, to prevent pathological myopia onset and complications associated with it. So, four pillars for myopia care should be hospital involvement, schools involvement, parents and government policy making should be important in the field of myopia care. So a recent myopia awareness survey we conducted within our hospital, which included 141 ECPs, in-house ECPs. So this survey revealed that around 89% have basic awareness about myopia regarding grades of myopia, its definition, and how to correct undetected refractive errors. But only 58% had the knowledge of how what high myopia is, complications associated with high myopia, and how to monitor a child with high myopia. Whereas only 18% had the awareness regarding myopia control of what abnormal myopia progression is and what myopia control strategies should be adopted. Only 18% had the awareness. So we then decided that it's time to educate about myopia and do myopia control if there is any abnormal progression. So then, under our guidance of our head of the institute, Dr. Sharad sir, we conducted several myopia awareness campaigns among the ECPs and fully trained them regarding myopia awareness to pick up children at risk for myopia and how to adapt myopia control strategies. So our aim is to educate all our ECPs, all our team regarding identification of at-risk myopic children and establishment of a uniform protocol for myopia care. And we have a very strong outreach team which is doing active work since the past 2 decades. But for the past 2 years we also trained them regarding myopia care to pick up at risk myopic children and to identify them with risk factors for myopic progression and to refer them to the main center. And these are our this is our outreach team conducting school eye screening camps, detecting children with myopic refractive errors or undetected refractive errors, and educating the teacher as well to regularly screen the child at least once in every 6 months. And we also distribute pamphlets regarding myopia care, which is in a very understandable language even for the child or parents in our native language. We often conduct interactive sessions where we, even our heads of the institute, Dr. Sharad Garu and Dr. Annapurna Garu, interact with parents and kids, spending their quality time to implant awareness regarding myopia. This is a recent Little Eyes awareness campaign we conducted on the occasion of Children's Day, and we interacted with the parents and the kids regarding how to maintain healthy eyes and what lifestyle adaptations are needed to maintain eyes healthy and to prevent myopia onset or progression. So, focus forward, there should be a digital comprehensive myopia prevention and control strategy where four pillars of the community should be equally participating in it, like government in the form of policy making. There should be a uniform policy regarding including the child's refractive error or the child's refractive status, like as we have a pediatric vaccination chart which is uniform all throughout the nation, the child's refractive status should also be included or should be connected with other number or so, where uniform refractive status is on submitted on an online portal, and for every 6 months refractive error is checked of every child. And regular school visits by an ophthalmic assistant or an eye care professional should be there once in every 6 months to detect refractive errors, and if there are any should be referred to a nearest eye care center. And from parents regard, they should maintain children with healthy lifestyle patterns, and if any sort of refractive error or any doubt is there, regular eye checkup should be conducted. Thank you.